Afternoon, and thanks to all of you for being here. Just a couple of introductions. Jeff Stern, who directs our Department of Emergency Management. Secretary Brian Moran, who is our Secretary of Public Safety. Secretary Dan Carey, our Secretary of Public Health. Norm Oliver, who is our Commissioner of Health. And Congressman Donald McEachin. Donald, thank you for joining us this afternoon. I want to give an update on where we are and actions we are taking to keep Virginians safe. As of this morning, Virginia has 45 people who have tested positive for the coronavirus. Yesterday, Virginia also had our first death from this virus, a man in his 70s in the Peninsula Health District. I extend my sympathies to his family and loved ones. The Peninsula Health District currently has a cluster of cases, 8 as of last count. For that reason, we are taking additional steps to limit contact between people to limit the spread of this virus. Earlier today, I announced that all local governments on the peninsula will close to the public for 2 weeks. That includes James City County, Williamsburg, Newport News, Poquoson, Hampton, and York County. To be clear, these local governments will continue to provide services, picking up of trash, sheriff's department, etc. But this closure will limit contact between people as we work to stop the spread of this virus in our community. I thank these government officials for taking this important step. This is consistent with direction we have given our state agencies to plan for remote working as much as possible. I want Virginians to understand we are taking this seriously, and so should they. We have declared a state of emergency. We have closed K-12 schools across our Commonwealth. We have restricted visitors at nursing homes and correctional facilities and limited state employee travel. Earlier today, we announced a ban on special public events over 100 people statewide. It's just not a good idea for that many people to be close to each other right now. We ask people to use common sense. That means events that bring together more than 100 people in a single room or a single confined space at the same time without room to spread out. It means events outside the normal course of daily life. Parades or festivals, gatherings in auditoriums, stadiums, or conferences. It does not mean normal operations at airports, offices, hospitals, restaurants, grocery stores, or other retail establishments. What we are trying to achieve here is the kind of social distancing that experts tell us is critical to stopping the spread of the virus. We all want to end this pandemic. And everything we hear from the experts tells us that slowing its spread is critical to keeping more Virginians healthy and ensuring what we do does not overload our health care system. So I urge Virginians, particularly those in places where there are known outbreaks, such as the peninsula, to please stay home. If you're going to a crowded bar or a large church full of people, I would urge you to rethink those plans. Ask yourself if it's really that important that you go out right now. Social distancing now can save lives later. These are critical steps to reduce and slow the spread of this virus. I will now turn this over to our State Health Commissioner, Dr. Norm Oliver, to update us on the latest developments. Dr. Oliver, thank you.
Thank you, Governor. As the Governor said in his opening remarks, we have 45 cases of COVID-19 in the Commonwealth at present. When we identify a case, we do what we call contact investigation, and we are looking into hundreds of contacts of these cases to trace down any new cases and to isolate them when we find them. There will be new cases, we know that. In particular, we're very concerned about the outbreak in the Peninsula region. As the Governor mentioned, there are 8 identified cases and upwards of close to 300 contacts that we're doing investigations on from those cases. We are also very concerned about the likelihood of actual community spread of COVID-19, or the virus that causes COVID-19 in the Peninsula region. And for all those reasons, we're going full court press on trying to identify those cases well ahead of time and isolate them as we do identify them. We have currently at the state lab somewhere between around 500 to 600 tests available that would be for individual patients, depending on how many specimens come in from each patient. And as you all know, private labs have come online, and that has increased our ability to provide testing to people in the Commonwealth and across the country. Many tests right now are pending, and we will keep you informed as new results come in. Thank you.
Thank you, Dr. Allen. As you all know, early Saturday morning, the House of Representatives voted on a relief act, federal relief act, and we're pleased to have Congressman Donald McEachin from the 4th Congressional District to address that and perhaps answer any questions you might have. So, Congressman McEachin, thank you.
Thank you, Governor. Good afternoon. I thought I might begin to make sure that you all understand that there have actually been 2 actions by your Congress in this regard. The first one was passed on March 3rd, which was the $8.3 billion relief package. About $2.2 billion of that is set aside for public health funding for prevention, preparedness, and response, including about $950 million to support state and local health agencies. It also allows about $7 billion in low-interest loans for small businesses that are affected by slowdowns and shutdowns, $300 million to ensure access to affordable vaccines when they come online, $3 billion for research and development of those same vaccines, and about $1 billion for medical supplies, healthcare preparedness, and medical surge capacity. That has been done. That's passed both the House and the Senate, and has been signed by the President. What the Governor was referring to is what we passed in the early hours of Saturday morning, the Families First Response Act. We are still awaiting Senate action on that. Hopefully on Monday they will move forward with this. That bill provides for free testing for the virus for anybody who needs it, whether it's private insurance, Medicare Advantage, Original Medicare, Medicaid, CHIP, VA, FE, HBP, or TRICARE, or the uninsured, all can have free testing. It strengthens food assistance, includes more than $1 billion to provide food to low-income pregnant women and mothers with young children, to help food banks and provide meals to seniors. It also protects students' access to school meals in the event of school closures. It also safeguards Medicaid benefits. It enhances unemployment aid and establishes paid leave. And the paid leave piece right now would extend to about 85 million workers. The Democratic position was that we wanted to have it universal. We couldn't get universal, and we decided that rather than have a standoff, we needed to do something. And so those 85 million will, generally speaking, will have access to 2 weeks paid leave. And then we will continue as a caucus and as a Congress to push forward in the hopes of getting greater access and greater leave policies in place for the American people. I'll yield back to the Governor, and I'll be still here to answer any questions that you might have.
Thank you, Congressman.
Thank you, Governor.
The health of Virginians and our communities is our most important priority right now. This is serious. Everybody needs to take this seriously. I want to give a special thanks to our healthcare providers, the doctors and nurses in our hospitals, the emergency responders, the public health experts, and the workers at the state lab. They have been working overtime literally around the clock to keep people healthy, and there is more work ahead of them. We are doing everything we can to ensure that our health system has what it needs to handle this situation. I also want to again remind Virginians about taking basic health precautions. Please wash your hands with soap and water. Please cover your mouth and nose when you sneeze. Stay at home if you feel sick, and avoid touching your face. We can get through this together, but it is everyone's responsibility to help keep ourselves and each other safe and healthy. We'll be glad to address any questions you may have.
Yeah, Kate. Can you explain why these cases in Peninsula County are considered a cluster, and if these depend in Fairfax, for example, or not?
Sure. You want to address that?
Perhaps the best way to explain this is that the cases in the peninsula were all associated with two index cases. They all trace back to the same contacts. So it was a cluster around those, whereas the other cases were from different sources, some from international travel, some from contacts with others who had had international travel, but they weren't all clustered together. The cases in the peninsula, as I said, were all clustered around two index cases, except for one case, which we were unable to find any source of exposure, and it's that case that makes us concerned for the likelihood of community spread in the peninsula.
Yes.
For the schools that are closed K through 12, what
Yeah.
does this mean for faculty and staff? I know there's a lot of confusion as far as how this is going to give out that schoolwork, and are they going to be the ones that are back in the
Yes, that's a great question, and it's not like we're locking the doors to the schools. Essential personnel will be able to go to the schools, and that will be really at the discretion of the principal. But if, for example, if someone needs to work online, that they want to, move forward to their students, then that will be allowed. But in general, obviously the students won't be there, and non-essential personnel won't be there.
So it's really up to that particular school and the principal to establish how teachers go about getting out schoolwork.
That's right. Well, and the schoolwork, and so I think maybe another question that may come up, if there is online that's going out to students, it's certainly not going to be mandatory. It'll just be able to help them stay, up with their schedule. But obviously, there's some households that don't have availability of the internet, and so that's one of the reasons why we're trying to get broadband across the Commonwealth right now. But certainly it won't be mandatory learning. Yes.
Back to the one case on the peninsula in James City County that you haven't been able to trace the exposure to. Was that the individual who died?
Yes, it was the individual who passed away.
And so in a case like that, what do you do? I mean, how do you map out how to track down that individual's contacts? Since you have, at least presently, you haven't been able to identify that victim's exposure.
We are doing a very extensive investigation of that individual's contacts. What I was referring to was we could not trace where that person was exposed to the virus. That's what we couldn't track down. We know that person's contacts and have begun identifying people. In fact, one of that 8th case was someone who was a contact of that patient.
And so real quickly, and also earlier in the television conference, there was reference to, I think, 284 contacts. Was that all of the James City County cases, or the 284, is that reference to the victim who died? Was that the community spread?
It's in reference to all of the James City County cases.
Governor, what would you say to institutions who are allowing students to go home for spring break but come right back versus taking more time off? Some are concerned about maybe students bringing viruses back in the day.
It's a great question, and I think that we need to take this on a day-to-day basis. As we've said all along, this is a very fluid, dynamic situation, and if, for example, in certain areas of Virginia we we do end up having community spread, then obviously other decisions are going to be made. But we're kind of taking in the data as we are able to, and then making decisions depending on that.
If I could follow up.
Sure.
What about state offices?
Yes.
In terms of the personnel?
Good.
You already addressed that.
We didn't today, but I appreciate the question, and we're making arrangements in a phased-in type of schedule to do telework. We want to be able to keep our state agencies open and able to service the public. But just again, going back to the no rooms with more than 100 people, I mean, we will follow those guidelines, but we are pursuing the ability for our state agents, our employees, to continue their work through telework.
How do you all feel about testing kits right now and with buddies coming online to try to reach?
Yes. Henry, I appreciate the question. I may let Dr. Oliver, or perhaps even Dr. Tony, come on up. Welcome. We just so happen to have from our labs here in Richmond. Thank you for being here to give us an update.
Good morning. I'm Dr. Denise Toney. I'm the director of the Department of General Services Division of Consolidated Laboratory Services. With respect to test kits, we have recently updated our numbers, and so we have the capacity today to perform tests on approximately 370 to 470 individuals. We have orders that have already been placed with the Centers for Disease Control, and we are hopeful that we will get additional test kits next week. And we are also looking into other ways that we can optimize the number of tests that we can provide for the Commonwealth. Did that answer your question?
To emphasize that we still need to screen before we test.
And as the governor mentioned, the testing that is conducted at the state lab is performed in close consultation with the Virginia Department of Health, and testing at our facility is only done on those individuals that the health department has investigated and has approved for testing at our facility. There are other individuals within the Commonwealth that are receiving testing, and much of that testing is being done at the private sector.
Do you know how many tests you all have done at the state level?
Those numbers are being updated daily and are posted on the Virginia Department of Health's website.
Councilor Moore, yes.
Yes.
You mentioned your
Well, we obviously want to be able to keep our businesses moving forward, but just as an example, in a restaurant, I'll just try to give you a quick example. Maybe, space the tables out. In other words, don't seat people at every table in the restaurant, but every other table to really encourage the social distancing. So we'll continue to be able to, to live and continue our businesses to be able to do what they do, but just using some of the guidelines. And again, the purpose of all this, and there's going to be I understand a lot of what ifs, and everybody has their own situation, but this is to keep Virginians safe, and this is also to, as best we can, to stop the pandemic as soon as we can. So again, this is one of the reasons we're doing this, is to emphasize to people to use these common sense guidelines to really get past this pandemic.
Governor, do you think that there should be any need to get the General Assembly to take any look at this, pass any relief for people in Virginia or businesses in Virginia, and some of the things that the Congress and stuff that the federal government doing?
I think right now, Greg, we just finished session on Thursday, and we have reconvened session in about a month, and so we're working through, obviously, over 1,000 pieces of legislation. We're watching very closely how the economy in Virginia is doing, and certainly if we need to take action, if I need to have the legislators back here sooner than reconvene session, we will. But I don't anticipate that right now, Greg. But one of the options that I think has been talked about that we'll kind of do if we need to is a reforecast before we sign the final budget. But I'm in consultation with with our budget leaders, as well as our majority and minority leaders in both the House and the Senate. And we'll just be flexible right now, but I don't anticipate bringing them back before a reconvene session.
Got time for one more.
I have a question for Dr. Carey, if you don't mind.
Yes, sir.
Dr. Carey, good to see you again.
Nice to see you, sir.
For those who still don't take the virus as serious as some think they should, there are still a lot of people who seem to think that this is being overblown. From the medical perspective, you say what to those who have that kind of.
Well, I'll repeat what the governor has said in the past, and we've said in other forums, that we should take this extremely seriously. We don't want folks to panic, but we do want them to plan and to be prepared. And those goals continue. And as the governor has indicated, that means social distancing, and we're continuing to refine that as indications, as conditions on the ground demand it. So my comment to the public is to, again, take this seriously. It is, as we're seeing in this country and seeing in Europe, as we've seen in other countries, it has serious consequences to individuals. People have died in Virginia from this. People have died in Washington State and other areas around the country. And that our best defense is prevention and the hand washing, the social distancing, staying home when you're sick, avoiding unnecessary travel out into the public square. So I hope that the message is coming across that this is indeed very serious, and we're seeing the evidence of that. And the governor's response and the response of our federal government is showing how serious the country is taking this, as it should. Thank you.
In closing, first of all, I want to thank my fellow Virginians for taking this seriously and for being available to watch press conferences like this so that they can get the best information that is out there. I also want to take the opportunity to thank the media. For those of you from our networks, our radios, our journalists, our newspapers, thank you so much for what you're doing. You are our conduit to getting accurate and up-to-date information to Virginians. At the end of the day, what we're trying to do is to keep Virginians as safe as we can and working together to get through this pandemic as quickly as we can. So thank you all so much, and have a good rest of Sunday afternoon.